My name is Josie Minks and I'm a labor and delivery nurse. I'm going to tell you a little bit about what a labor and delivery nurse does. There are many jobs of a labor and delivery nurse. One is antepartum, which is before a woman delivers. There's some sort of complication and the woman needs to be in the hospital, such as complications like if her bag of water is broken or she's bleeding or the baby is stopped moving or anything along those lines, or her cervix is dilated and she needs to be in the hospital on bed rest. And so the labor and delivery nurse would manage her care. Or also a labor and delivery nurse does OR circulation in the operating room for C-sections. So he or she would do the scrub and just set up for the entire C-section. And the labor and delivery nurse would also do triage. So if a woman thinks her bag of water has broken or she's having contractions and she thinks she's in labor, she would come into the hospital and the labor and delivery triage nurse would determine if she's really in labor and if she needs to stay in the hospital or she can go home and rest. The L&D nurse can also do inductions in labor and manage the patient's care when the woman's in labor, which means she is doing consents, starting IVs, discussing the plan of care, setting up for epidurals, doing coaching and breathing exercises and positioning, managing the baby's heart rate and make sure that the baby's cared for if there's any fetal heart decelerations. And then also looking out for any complications like a placenta previa or abruption or a cord prolapse or any kind of complications. And the labor and delivery nurse is also a postpartum nurse, and so she's managing the care after the baby is born and watching out for hemorrhaging or any kind of complications after the baby is delivered. And then also the labor and delivery nurse is certified in neonatal resuscitation, and so she is taking care of the baby once the baby is born as well. And these are the positions of a labor and delivery nurse.